joking. He said, I just paid $88. And in New York, I pay $1,300. What the hell is going on? He said, so I checked. And it's the same box, made in the same plant, by the same company. It's the identical pill that I buy in New York. And here I'm paying $88 in London. In New York, I'm paying $1,300. Now, this is a great businessman, but he's not familiar with this crazy situation that we have. But he was stunned. But it was just one of those stories. And I brought it up with the drug companies, represented by somebody who's very, very smart, good person, too. And we argued about it for about half hour. And then finally he just said, because they can't justify it, he just said, look, you got me. You got me. I can no longer they've been justifying this crap for years. They said, oh, it's research and development. Well, I said, well, research and development, other countries should pay research and development too. It's for their benefit. It was just one of those things. And the other countries would set a price, and they'd meet the price, and they'd say, if you don't meet the price, you can't sell it in our country. I said, well, then you walk away, and, they'll call you back, and they'll sell it in the country. But now they'll have to do that. So for the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. Drug prices will come down by much more, really, if you think 59. If you think of a drug that is sometimes 10 times more expensive, it's much more than the 59%. It depends on the way you want to analyze it, but in one way you could analyze it that way. But between 59 and 80, and I guess even 90%. So when I worked so hard on the first...
You've got a big new website idea and the team loves it. Instead of taking months to build it, why not just use Framer? With Framer, designing is building. No handoffs, no waiting. Build your full website. Build landing pages.
And Pharma has to say, we're sorry, but we'll not be able to do this any longer to these countries that have been so tough. They've been very tough, nasty. It's trade. It's trade. And Pharma is also very powerful. And the Democrats have protected Pharma. This is the Democrats have protected Pharma. These are the Democrats. And by the way, I just called the Speaker of the House, and I just called the leader, our leader in the Senate, John Thune, Mike Johnson. Spoke to both of them. I said, when you score, you're going to have to score two things. You're going to have to, number one, score that hundreds of billions of dollars of tariff money is coming in. But even bigger than that, you're going to have to score that your cost for Medicaid and Medicare and just basically pharmaceuticals and drugs is going down at a level that nobody has ever seen before. It'll pay for the Golden Dome. I see the Golden Dome is there, see? That'll easily pay for the Golden Dome. And we'll have a lot of money left over. We need the Golden Dome, by the way, in this world. Although this world's a lot safer today than it was a week ago, and a lot safer than it was 6 months ago. We had people that had no clue what they were doing. So today, Americans spend 70% more for prescription drugs than we spent in the year 2000. Think of that. Our country has the highest drug prices anywhere in the world by sometimes a factor of 5, 6, 7, 8 times. It's not like they're slightly higher. They're 6, 7, 8 times. There are even cases of 10 times higher. So that you go 10 times more expensive for the same drug, that's big numbers. Even though the United States is home to only 4% of the world's population, pharmaceutical companies make more than 2/3 of their profits in America. So think of that. With 4% of the population, the pharmaceutical companies make most of their money, most of their profits from America. That's not a good thing. Now, I think, by the way, I have great respect for these companies and for the people that run them. I really do. And I think they did one of the greatest jobs in history for their company, convincing people for many years that this was a fair system. And nobody really understood why, but I figured it out. For years, pharmaceutical and drug companies have said that research and development costs were what they are, and for no reason whatsoever. They had to be borne by America alone. Not anymore, they don't. This means American patients were effectively subsidizing socialist healthcare systems in Germany, in all parts of the European Union. They were the toughest of all. They were nasty. And I see that. I see that with trade, too. European Union is, in many ways, nastier than China. Okay? And we've just started with them. Oh, they'll come down a lot. You watch. We have all the cards. They treated us very unfairly. They sell us 13 million cars. We sell them none. They sell us their agricultural products. We sell them virtually none. They don't take our products. That gives us all the cards, and very unfair. So they're going to have to pay more for health care, and we're going to have to pay less. That's all it is. And believe it or not, you know, because it's really the world we're talking about, not just the European Union, but because it's the world, the numbers are for the healthcare company not as bad as you would think. They'll make the same. I think the healthcare companies should make pretty much the same money. I really don't believe they should be affected very much, because it's just a redistribution of wealth. It's a redistribution where it could be the same top line, but it's going to be distributed differently. Europe's going to have to pay a little bit more. The rest of the world's going to have to pay a little bit more, and America's going to pay a lot less. Again, because it's a much smaller population than when you think of the whole world. So basically what we're doing is equalizing. There's a new word that I came up with, which I think is probably the best word. We're going to equalize, where we're all going to pay the same. We're going to pay what Europe's going to pay. We're going to all pay. Now, there may be some countries in dire need, and I would be willing to sacrifice that, but and help them.